What's for dinner? A proposal to improve access to healthy foods. My name is Julia Clift, and I'm a nurse practitioner student at UAMS. I'm presenting a proposal to the Arkansas House of Representative Joyce Springer from District 34. This presentation is aimed at the legislative branch of government. When looking at these two photos, most individuals would agree that the left photo contains more nutritious foods. While this seems simple, why do some people choose to eat more foods more like the picture on the right? The most important question is, do all people have the same opportunities to access healthy food? Individuals who live in low-income areas or rural areas are often the most limited to obtaining healthy foods. This knowledge is especially important when addressing health disparities among populations. Addressing these health disparities can help reduce the chronic disease burden caused by obesity. According to America's Health Rankings, the obesity rate in Arkansas in 2019 was 37.1%, and Arkansas also ranked third in the U.S. This statistic is an increase from 2018 when the rate of obesity was 35%. Obesity is defined as a body mass index of 30 or above. Nearly 40% of adult Arkansans are obese, and being overweight or obese is directly linked to many chronic diseases. High-fat and high-sodium foods lead to hypertension and high cholesterol, which greatly increases the risk for heart disease and stroke. There is also an increased risk for type 2 diabetes. 1 in 3 people have prediabetes and don't even know it. Not only does poor access to healthy foods cause obesity and thus chronic disease, but the cost of medical treatment for preventable disease is astounding. According to Arkansas Coalition for Obesity Prevention, obesity-related medical treatment costs between $147 and $210 billion a year, or nearly 10% of all annual medical spending. To combat poor nutrition and obesity, we must first understand barriers to accessing healthy food. As mentioned, low-income neighborhoods, racial minority communities, and rural communities tend to have less supermarkets compared to wealthier or urban areas. Other barriers to accessing healthy foods include dependence on public transit, difficulty transporting groceries home due to unreliable transportation, and lack of healthy food options due to cultural preferences. Also, healthy foods tend to cost more. Another barrier is low-quality food selection. Increasing access to healthy foods will not only serve population health, but it can also be beneficial economically. Stagnant commercial areas could be restored since grocery store locations often draw other retail businesses near. New jobs would also be available to support the community. So how do we bring in healthy food retailers to underserved communities? We must first acknowledge barriers to starting a new business in underserved areas, such as potential financial concerns due to low-income population, theft, and safety. Lastly, established food retailers may not have the equipment to properly store perishable items. The CDC Health Equity Guide recommends that policymakers support healthy food retailers by simplifying applications and permit procedures and bundling land to encourage grocery stores in low-income areas. Support should also be provided, such as staff training in handling perishable items and free advertising for healthy food retailers. To address the cost of healthy foods, the CDC Health Equity Guide recommends promoting food assistance programs such as Women, Infants, Children, and the Supplemental Nutrition Assistance Program. Also, people could be encouraged to buy healthy foods using SNAP by providing incentives such as the Double Up Food Points. To support the economy, food production and local farms should be connected to healthy food retailers in the community, which would also keep food dollars within the community. Next, the community could also provide workforce training programs to support high-quality employees in food retail. To address the problem with transportation for some individuals, the CDC advises that transit routes frequent healthy food stores. People must also be able to get the transit system, so sidewalks and safe walkways should be repaired or created in the community. Lastly, programs that provide van transportation to rural residents or elderly should be established. The next barrier to accessing healthy foods in low-income areas is safety and the fear of violence. Policymakers should rally for more law enforcement positions and increase patrol in areas with higher crime rates. As explained, many individuals rely on walkways and public transportation, so safety is of utmost importance. Low-income communities have disproportionately more fast food restaurants than healthy grocery stores. The CDC described efforts to reduce fast food restaurants in targeted communities in Los Angeles. The city created a grocery store and sit-down restaurant incentive package to create economic incentives for potential businesses. A moratorium was placed on permits for new fast food restaurants. My call to action for policymakers in Arkansas is to support local grocery retailers in low-income areas by providing economic incentives, training business owners and staff on how to manage perishable foods, increase farmers markets, and improve public transit routes. Philadelphia, Pennsylvania increased access to healthy foods by creating the Healthy Corner Store initiative. Established corner stores were given incentives, staff training, and support for store renovations to support healthy foods. Many low-income neighborhoods rely on corner stores for food. Another success story, residents of Baker County, Georgia partnered with the Georgia Strike Force Initiative and the Federation of Southern Cooperatives to utilize unused public land and restore into farmers markets for underserved communities. While there are farmers markets in Little Rock, Arkansas, we must ensure that all communities have access. All in all, increasing access to healthy foods in underserved communities will have impact on community health. Targeting the obesity epidemic through planning and community strategies will help reduce the incidence of heart disease, hypertension, stroke, and type 2 diabetes, thus reducing healthcare costs. Thank you for watching my presentation.